Chapter 20, Evaluation. Evaluation is a crucial step. It is the fifth step of the nursing process. This step will determine whether the patient's condition or well-being has improved after the nursing interventions were delivered. It is imperative for a nurse to monitor ongoing a patient's clinical progress. Critical thinking in the nursing practice strengthens clinical performance and reflects the nurse's ability to resolve patients' health-related problems. Evaluation monitors the progress of each of the patients and gives the nurse valuable information about the efficacy of the nursing interventions. The outcomes of nursing practice are measurable conditions of the patient, their status, their behavior, or their perception. The outcomes are the criteria for judging the success when we deliver nursing care. The American Nurses Association defines standards of professional nursing practice, which include standards for the evaluation step of the nursing process. The standards are authoritative statements of the duties that all nurses, regardless of their role, population they serve, or specialty, are expected to perform. The competencies for evaluation include being systematic and using criterion-based evaluation, collaborating with patients and other health personnel, using ongoing assessment data to revise the plan as necessary, and communicating results to patients and families while delivering nursing care. Critical thinking is key to evaluation. In Chapter 15, it was mentioned that clinical decision-making is complex, requires flexibility, and the ability to know and recognize subtle changes or aspects of the patient's condition. This examines the results of care according to the clinical data collected. Using critical thinking in the nursing process, we can compare, achieve effects or outcomes with the goals and expected outcomes. We can recognize errors or omission, and as a nurse, we can understand the patient's situation, reflect on the situation, and correct any errors. Nurses are accountable for and obligated to evaluate nursing interventions and outcomes in the areas of health promotion, prevention of illness and injury, and alleviating of suffering. Evaluation occurs whenever the nurse has contact with a patient. It is an ongoing process. It includes a before and after comparison or an after comparison with an established standard. Evaluative measures are similar to and often the same as assessment skills and techniques that is performed during a patient's assessment. These will be observations, physiologic measurements, use of measurement scales, patient interview. Evaluative and assessment measures differ based on when you perform them. Evaluative measures are made following nursing interventions when you make decisions about a patient's health status and progress. A nursing plan of care includes mutually established goals and nurse-sensitive outcomes relevant to the patient's health status. Remember, a nurse-sensitive outcome is a state, behavior, or perception that is measured along a continuum in response to a nursing intervention. During evaluation, the nurse performs evaluative measures that allow the nurse to compare clinical assessment data, patient behavioral measures, and patient self-report measures collected before the implementation with measures gathered after administering nursing care. The nurse will then decide whether the results of the care match the expected outcomes and goals set for the patient. If outcomes are met, the overall goals for the patient are also met. Critical thinking directs the nurse to analyze the findings from the evaluation. Outcomes are statements that are progressive, step-by-step, physical, emotional, or behavioral responses that a patient needs to accomplish to achieve the goals of care. When the patient achieves outcomes, the related factors for a problem-focused diagnosis or the risk factors for an at-risk diagnosis will usually no longer exist, or they may be better managed. Understanding that the patient has kidney stones, how would you assess their pain? The student knows that evaluation is a blank process that occurs whenever contact with the patient occurs. The answer is ongoing. A patient's clinical condition will often change during an acute illness. A chronic illness results in slow, subtle changes, although acute exacerbations may occur. Careful monitoring and early detection of problems are the nurse's first line of defense. The nurse always makes clinical judgment based on their observations of what is occurring with a specific patient and not merely on what happens to patients in general. Evaluation is easier to perform after you care for a patient over a long period. It is then easier and makes the nurse more able to make subtle comparison of patients' behaviors and responses. If the nurse has not cared for the patient for an extended period of time, the evaluation will improve by referring to previous experiences or asking colleagues who might be familiar with the patient to confirm the evaluation findings. The accuracy of any evaluation will improve when you are familiar with the patient's behavior, physiologic status, and have cared for more than one patient with a similar problem. During evaluation, the nurse must recognize errors and unmet outcomes that require the nurse to have an open mind, to actively pursue truth, to be patient and confident, and to engage in self-reflection. Apply observational skills, critical thinking, intellectual standards, knowledge, and reflections to recognize the actual results of the nurse's care. Reflection is a conscious effort to think about your interventions and outcomes. Consider what was positive or challenging, and consider how the plan of care might be enhanced, improved, or done differently in the future. What a nurse gains from caring for patients and carefully evaluating the outcomes of care later will contribute to ongoing clinical knowledge development and capacity for making clinical judgments about future patients. This process will help correct and prevent errors. Reflective reasoning improves the accuracy of clinical decisions and making diagnostic conclusions. The result of an evaluation helps the nurse decide whether to continue, discontinue, or revise the plan of care for the patient. When there are unmet or partially met goals, or if the nurse determines that perhaps a new problem has developed, then reassessment is necessary. A complete reassessment of patient factors relating to an existing nursing diagnosis and etiology is necessary when modifying a care plan. If outcomes have not been met, it is helpful to consider the SMART acronym. An important step in critical thinking and evaluation is knowing how a patient is progressing and how problems resolve or worsen. After the nurse determines that their patient has met expected outcomes and goals, the nurse will confirm the evaluation with the patient when possible. If the nurse and the patient agree, the nurse will discontinue that part of the care plan. The documentation of a discontinued plan ensures that other nurses will not unnecessarily continue interventions for that part of the plan. The evaluation of interventions examines two factors. First, the appropriateness of the intervention selected, and then second, the correct application of the intervention. When patients do not meet goals or outcomes, the nurse performs a reassessment and identifies factors that will interfere with their achievement. Usually, a change in the patient's condition, needs, or abilities makes an alteration of the care plan necessary. This will require the nurse to continue interventions either as planned or less or more often, or the nurse will choose to add interventions focused on the factors affecting goal achievement. Your patient has met the goals set for improvement of ambulatory status. You would now modify the care plan, discontinue the care plan, create a new nursing diagnosis that states goals have been met, reassess the patient's response to care, and evaluate the implementation step of the nursing process. The answer is B. When the goals are met, the care plan for that goal is discontinued. Which of the following is an end result that translates into observable patient behaviors that are measurable and desirable? Unexpected outcome, expected outcome, sensitive outcome, accomplished outcome. The answer is B. An important aspect of evaluation is always collaboration. Patient-centered care is achieved only when the patient and the family are actively involved in the evaluation process. This requires the nurse to consider what is important to the patient, including their values, preferences, and needs. It is essential for nurses to collaborate closely with all of the healthcare team during evaluation. Successful collaboration involves interactions where professionals work together cooperatively with a shared responsibility and interdependence toward achieving the patient outcomes. Proper evaluation determines the effectiveness of nursing interventions. This includes evaluating whether each patient reaches a level of wellness or recovery that the healthcare team and patients established in the goals of the care plan. Documentation and reporting are important parts of evaluation because it is crucial to share information about a patient's progress and current status. Accurate information needs to be present in a patient's medical record and shared during handoff communication so that nurses and other personnel know whether a patient is progressing and can make ongoing clinical decisions. An example: clearly documented goals and expected outcomes for new or revised nursing diagnoses are necessary so that all members of the team are aware of a revised care plan. The nursing documentation should present a clear argument from the evaluative data as to whether a patient is progressing. One of the ANA standards for evaluation is to share the results of care with patients and their families according to the federal and the state regulations. Keeping patients and families informed about the patient progress. The Centers for Medicaid and Medicare do not reimburse healthcare agencies for the costs associated with treating preventable adverse outcomes like air embolism, blood incompatibility, or stages 3 or 4 pressure injuries. There are 11 preventable adverse outcomes. 4 are severe pressure injuries, falls and trauma, and catheter-associated urinary tract infections, as well as vascular catheter-associated infections. These are nursing-sensitive quality outcomes that can potentially be decreased with greater and better nursing care. The student follows which steps to objectively evaluate the degree of success in achieving outcomes of care for Mr. Mashoud. Identify the exact desired patient behavior, evaluate the patient's actual behavior, compare the outcome criteria with the actual behavior, assess the desired behavior and anticipated outcome, judge the degree of agreement between the outcome criteria and the actual behavior. So the answer is A, B, C, and E. To objectively evaluate the degree of success in achieving outcomes of care, perform the following steps. Examine the outcome criteria to identify the exact desired patient behavior or response. Evaluate the patient's actual behavior or response. Compare the established outcome criteria with the actual behavior or response. Judge the degree of agreement between the outcome criteria and the actual behavior. If there is no agreement or maybe partial agreement between the outcome and the actual behavior, identify the barriers and the rationale for the barriers. You have finished with several nursing interventions. To evaluate interventions, you need to examine the appropriateness of the interventions and the correct application of the implementation process. Nursing diagnoses to ensure that they are not medical diagnoses. Care planning process for errors in other healthcare team members' judgments. Interventions of each nurse to enable the nurse manager to correctly evaluate performance. The answer is A. When evaluating, the nurse needs to look at the patient's condition, the interventions used to improve the patient's status, and whether or not the interventions were appropriate.